of 3,841. Each of the past 2 days, Judy, if my math is right, have been an increase of more than 100 each of the 2 days in a row. Of that 3,841, 3,612 were COVID positive, 229 were awaiting their test results. That number, by the way, is our highest number since May 13th. Remember, 3,841, our peak was 8,270. Throughout the day yesterday, good news is 426 live patients were discharged, and that is not to be underappreciated, but another 498 COVID positive patients were admitted. And again, it's apples to oranges. They've not yet been confirmed, but our 71 hospitals reported 62 in-hospital deaths yesterday. So of the patients in our hospitals last night, 765 of them were intensive care. That's the most since May 26, and 485 of them needed a ventilator. That's the most since May 29th. Again, if you go back 700, Dan, go back, there you go, 765 total in intensive or critical care. Judy, our peak was 2,080. So we're inching up high 30% of that number. Thank you, Dan. These numbers remain sobering. A week ago, our hospital numbers were actually dropping a little bit, and now they're even higher than they were 7 months ago. And they remain the biggest reason why we can't get lax in our precautions, in our social distancing, in our wearing of masks. And it's the reason why this year cannot be the year for the large Christmas for family and friends. I hate even saying that. I hate hearing it. It's lousy for all of us, but that's the way it's got to be. As we noted on Monday, the weeks following Thanksgiving, the numbers of residents needing hospitalizations or needing an ICU bed or a ventilator all jumped. Our healthcare workers are doing heroic things, but it is up to us to keep our loved ones out of the hospital. And to anyone who is under the misconception that no one is dying from COVID anymore, let's dispel this myth right now. Today, we're reporting another 103 blessed members of our New Jersey family have fallen to COVID-19. Our count is now of confirmed 16,521. The probable deaths has been revised upward to 1,945. So today, 103 losses of life. Yesterday, 104 deaths. That's the first day since June 13th, I believe, which is more than 6 months ago, that we reported at least 100 deaths. And with today, we have our first back-to-back days of 100 or more deaths since the end of May. And of the 103 we are reporting today, all but a handful have actually come over the past week. These are all families whose Christmas will be spent remembering a loved one who is no longer with them. I actually got a jump and started making some calls to families who have lost loved ones who we will salute and memorialize on Monday. And I guess 3 families, Judy, all 3 of them, the individuals died within the past couple of weeks. So this has gone from a month or 2 ago. I was calling families regularly who lost somebody in March or April, still making up for lost time. These folks lately have been dying literally in the past number of weeks, if not days. So let's honor a few more families, a few more loved ones rather, we've lost, and families who we join in mourning those who have lost. We begin by remembering Evelyn Gillick. What a beautiful picture there. A longtime resident of both Cranford and Rockaway, who was 93 when she passed on Thanksgiving. For many years, Evelyn was a secretary for the Elizabeth Board of Education before ending her career in the private sector with the McDonough and Sullivan law firm in Watchung. But even more importantly, Evelyn gave back. She was a volunteer for the Summit Speech School for the Hearing Impaired. She would often keep a list of yard and garden sales to stop at to buy baby clothes, which she would then donate to young moms in need. And she would do anything for her family, whether it be a care package or jumping right into the fray during a grandchild's birthday party. Her husband of 67 years, John, passed away in June of 2018. Together, again, I am sure they are recalling the vacations they took in retirement, which allowed them to travel the world. So Evelyn now leaves behind her tremendous family. Son Steve and daughter-in-law Bernadette, and they're in West Caldwell. Daughter Evie and son-in-law Steve, they live in Florida. Daughter Kathy, with whom I had the great honor of speaking, and son-in-law Ken, they live in Randolph. And daughter Jean and son-in-law Charles, they're in Denville. And her beloved grandchildren, Nicole, Caitlin, Kevin, Eileen, Erica, and Brendan. Kathy, her daughter, recalled particularly how much her mother loved gifts. It didn't matter what it was the thought behind it. So folks, on Christmas, let's keep Evelyn Gillick in our prayers and remember those she left behind. May God bless and watch over her. Next up, we recall Newark's Sandra Arrington, known by many as simply San. She dedicated more than 20 years to the men and women and patients at University Hospital, most recently as the unit clerk in the neonatal intensive care unit. And San wasn't just another face at University Hospital. She touched so many lives, was so well known and so loved by her colleagues that she was recognized by many as the unofficial mayor of University Hospital. You know San, Judy's the former CEO there. And she didn't leave that caring nature at work. It was the environment she created at home for her daughters, Tamika, with whom I had the great honor of speaking on Monday, Hanifa, Sharifa, and Salima, or for the foster children to whom she opened up both her home and her heart, and for her 14 grandkids with whom she'd sit down and watch countless movies. It was what she shared with her husband, Michael, to whom she was married for the past 10 years. San also leaves behind her mom, Emily. Keep Emily in your prayers. Her brothers, Thomas, Alvin, and Julius, and her sisters, Elvira, Benita, and Julie, and their families. She also leaves behind, as Judy knows well, her beloved family at University Hospital. San passed away on December 7th, and she was just 60 years old. We thank her for her years at University Hospital, and may God bless and watch over her and comfort her family at this time. And finally, we honor Bayonne's Bob Weinel on the right side. Bob Weinel II, a graduate of Hudson Catholic Regional High at St. Peter's University. He proudly served 2 years with the United States Marine Corps, including time as a member of the Honor Guard stationed at Camp Smith at Pearl Harbor, Hawaii. After returning from the service, he became a member of Bayonne American Legion Post 19. He began his post-military career with Bell Atlantic and then switched over to a job as superintendent of operations at the MAR terminals at the Port of Elizabeth. From 1998 until his retirement in 2013, he worked for Continental and then United Airlines at Newark Liberty International Airport, overseeing the daily operations. We may be 2 days from Christmas, and I want Pat to pay particular attention here, but Bob's favorite holiday by far was St. Patrick's Day, where he'd let his Irish heritage take center stage and when his warm, funny, and compassionate nature would really shine. He was also an active parent, volunteer at St. Andrew's Elementary School and Church in Bayonne, and later at St. Dominic Academy. Bob is survived by his wife of 40 years, Mary Ellen. I had the honor of speaking with Mary Ellen. Both she and Bob were COVID positive. She skated through okay. He obviously was lost. They both came down with it on Halloween. He also leaves behind his daughter, Kimberly, and that's Kimberly in the middle. That's Bob on the right, by the way, Mary Ellen on the left, and that's Kimberly with her husband, Scott. Kimberly, I also had the great honor of speaking with. She is an NJJJC senior correctional police officer, carrying on that life of service. Her mom said, I'm not sure where she got it. I think it was the Marine and her dad that led her to this career. So God bless them all. He also leaves behind his sister Lynn and numerous nieces, nephews, cousins, godchildren, and friends. We thank Bob for his service to our country, for his lifetime of dedication to his hometown, and for representing the very best of our state and our people. May God bless and watch over his memory and his family. So 3 more families who are entering what should be one of the happiest times of the year, mourning loved ones lost to this pandemic. I cannot think of any better way to close than with the words Evelyn Gillick's family used in her obituary, and I quote the obituary, "In her beautiful memory, we ask that you please wear a mask." And on a point of personal privilege, this is on behalf of Dan Bryan and myself, I want to remember one more person we just lost, though not from COVID-19. On Monday, I learned of the passing of this guy, Chris Tobin, the Chief Technology Officer and Radio Engineer at WBGO in Newark, New Jersey. For the past 3 years, Dan and I, although the pandemic, we've been doing it on the phone. Chris has been engineering the program on telephone, but for most of the past 3 years, Dan and I will go in to do the radio version of Ask the Governor program from WBGO studios, and Chris was always there on the other side of the board, making it all happen. I am keeping, and we are keeping, Chris and his family, including his WBGO and New Jersey Public Radio family, in our prayers. He will be missed. So let's end today with a couple of stories that will lead us into the Christmas holiday with a sense of optimism for the times ahead. First up, let's meet Jebu Matthew. That's Jebu on the right. Jebu is the owner of Kochi, a Hightstown restaurant that specializes in cuisine from India's Spice Coast. With the pandemic impacting his establishment and with bills piling up, Jebu was on the verge of closing Kochi. However, by reaching out to the New Jersey Economic Development Authority, Jebu has been able to receive a pandemic relief grant to pay the bills and position Kochi back to pre-pandemic business. I spoke with Jebu on Monday to check in on his progress, and I know he's looking forward to getting back fully to his passion, which is cooking and serving his customers. And when he does, I hope everyone will stop by to celebrate that with him. And when they do, he's at 370 US 130 in Hightstown. That's 370 US 130 in Hightstown. Good luck, Jebu. And with Jebu in mind, a reminder that the application window for the EDA's new Sustain and Serve NJ grant program, pairing community organizations with our restaurants, is still open. For more information, go to that website, business.nj.gov/COVID. Together, let's get our restaurant workers back to doing what they do best, feeding New Jersey. And finally this morning, I had an incredible conversation after I saw you, Judy, with 5 extraordinary young men from my neck of the woods in Middletown. Tyler Armagan, Ryan Day, Joey Dietrich, Kieran Foley, and Drew Scalise. You may have heard this story. Last Thursday, as they were wrapping up a day of sledding at Beacon Hill Country Club, which is at the edge of Middletown and Atlantic Highlands, they heard something that did not sound right. And they turned in time to see a sled carrying 2 young siblings, a sister and brother, ages 8 and 4, and saw that sled fall through the ice into a pond at the bottom of the hill. This posse, by the way, includes some proud Boy Scouts, and they did not hesitate to take action. They formed a human chain with Kieran and Drew, I believe, at its head, and waded into the water, reaching the children and pulling them back to safety, and then staying with them to help warm them up before their father and mom were able to get to their sides. Thanks to their selflessness and quick thinking, there's one family that has a little extra to celebrate this Christmas. So I have to give a huge thank you to these 5 young lads with whom I spoke, and to Kieran's mom, Maureen, who was able to get us all on the phone this morning. Kieran, Tyler, Joey, Drew, and Ryan embody the spirit of our state, that we are truly one New Jersey family, and we all look out for each other. They deserve every bit, by the way, of the now national news coverage they are receiving, and we are all grateful that even in the midst of this pandemic, we have some truly good news to rally around. And that is a high point on which to leave this last briefing before Christmas. Again, I urge everyone, please keep your gatherings and celebrations to just your household. Let's get through the next 8 days in the strongest position to start 2021. With that, it is my pleasure and honor to introduce the woman who needs no introduction. Please help me welcome the Commissioner of the Department of Health, Judy Persichilli.
Thank you, Governor, and good afternoon. I am pleased to report that as of 11 a.m. this morning, 27,730 healthcare workers have received their first dose of, of vaccine in 54 hospitals and 6 other sites, including 2 FQHCs. Boosting vaccine confidence among healthcare workers is critical. They are trusted by patients and will play an important role in the public's understanding of why it is important for them to get vaccinated when the vaccine is widely available for the public. This week, the state received a total of 208,000 doses of both Pfizer and Moderna cumulatively. 34,000 went to long-term care, 175,000 are being distributed to hospitals, FQHCs, county and local health agencies, psychiatric hospitals, urgent care clinics, medical practices, pharmacies, and clinics will start using Moderna. They started using Moderna either yesterday or today. Overall, we now expect to receive a total of 405,825 Pfizer and Moderna doses in December. As we strive to ensure personnel throughout the healthcare system are vaccinated, the department last week announced a network of community-based vaccination sites. Today, we are announcing a very exciting partnership with Rite Aid to provide COVID-19 vaccinations to home care and hospice staff in the community. Rite Aid will provide end-to-end management of the process, including the cold chain storage that's required, and vaccinations at mobile clinics to vaccinate these healthcare workers. Information about scheduling appointments is being provided through the home health agencies and their industry associations. The department thanks the Home Care and Hospice Association of New Jersey and the New Jersey Hospital Association and the Home Health Services Association for their collaboration in this undertaking. As the governor mentioned, we will be visiting a long-term care facility Monday as they begin to vaccinate residents and staff as part of the federal pharmacy program. Both CVS and Walgreens will start vaccinating on Monday as part of this program. Of that, we have reserved 55,000 doses for the federal pharmacy partnership for skilled nursing facilities. The state expects to provide 112,000 first doses of Pfizer for vaccination of nursing home staff and residents over the next month. As of now, we understand that approximately 90 nursing homes are scheduled for vaccination clinics during the shortened holiday week next week. That number is expected to increase as additional clinics are scheduled. The pharmacies will visit the facilities several times in order to reach everyone with the first and second doses. As I outlined Monday, after nursing home residents and staff are vaccinated, CVS and Walgreens will begin to vaccinate thousands of residents and staff in other congregate settings, including assisted living facilities, the 5 state developmental centers, federal housing for seniors and group homes, and other long-term residential facilities. New Jersey is allocating approximately 500,000 first and second doses to cover these facilities that are part of the federal partnership program. So let me go over those facts again. We've allocated 55,000 doses to start the vaccination process in skilled nursing facilities starting Monday. This represents 45% of all the Pfizer doses received in our first 2 weeks. Walgreens and CVS will begin vaccinating residents and staff of SNF facilities Monday, December 28th, with over 90 facilities already scheduled for next week. All in, New Jersey is allocating a minimum of 500,000 Pfizer doses, that's the first and second doses, to cover approximately 1,700 facilities included in the Part A and Part B of the federal pharmacy partnership, which will be running all through the rest of December, all through January, and into February. These doses are the first to be allocated from the Pfizer availability each week. The partnership calls for the pharmacy providers to provide 3 on-site clinic visits per site over roughly an 8 to 10 week period. And the start of these clinics are arranged directly between CVS and Walgreens and the facilities. Recognizing that not every congregate setting was eligible for or enrolled in the federal partnership, we have a network of community vaccination sites for the rest of these vulnerable residents. We are also engaged in aggressive public outreach efforts to educate the public, and build trust in the vaccination process and the importance of getting vaccinated. Since September 30th, I have engaged in over 60 vaccine awareness calls with more than 4,000 stakeholders throughout the state. The calls share our vaccine rollout plan and our goals and encourage these stakeholders to join with us to build confidence in the vaccine. The stakeholders represented organizations including community and interfaith-based groups, pharmacies, higher education, elected officials, disability advocates, healthcare unions and associations, counties and local health departments, medical professional boards, law enforcement, and first responders. In addition, this week we are launching the first phase of a multimedia, multilingual, statewide public awareness campaign to create the public awareness to educate healthcare workers, other essential workers, and the public about COVID-19 vaccine safety. The campaign will include TV, radio, digital ads, billboards, social media, and transit ads. As part of our effort to make science-based public health education information as widely available as possible, the department's COVID-19 vaccination page includes fact sheets, FAQs, infographics, links to state vaccination plan, and various federal resources. In addition, the FDA has published translated fact sheets for both the Pfizer and the Moderna COVID-19 vaccines. The fact sheets, which are intended for recipients and caregivers, are now available on our vaccine webpage in more than 20 languages, including Spanish, Arabic, and Chinese. The FDA has also posted updated FAQs on both vaccines, which includes additional information on vaccine efficacy, development, and safety. It is important that residents stay informed and understand this process. All of these resources and more are available on the FDA's COVID-19 vaccines webpage. So moving on to my daily report, as the governor shared, our hospitals reported 3,841 hospitalizations with 765 individuals in critical care, and 63% of those patients are on ventilators. There is one new report of multisystem inflammatory syndrome in children, so there are currently 67 total cases in the state, and one of those children is currently hospitalized. Fortunately, we are reporting no deaths from multisystem inflammatory disease. At our state's veterans homes, we are reporting 2 new resident cases at the Vineland home, and our state psychiatric hospitals, we are reporting 2 new cases. The daily percent positivity as of December 19th is 12.97. The northern part of the state reports 12.46. The central part, 12.54. The southern part of the state, 15.16. All of us at the Department of Health wish you a safe and joyous season. The best gift you can give this season is protecting your loved ones, your neighbors, and your community. So mask up, wash your hands frequently, celebrate remotely, avoid gatherings, and for each other and for us all, please take the call. Thank you.
Judy, thank you. Thank you for the lengthy discussion on vaccines. Separately, the multilingual piece here is so important. I was on a Zoom last night with a bunch of largely Latino, not entirely Latino and Asian, I'd say, healthcare workers, and they were making the point that that multi-language is going to be important. And I said, I was proud that our first guy to get a shot, I knew this already last night, and as did you, was going to be a Latino doctor. And I said, if he doesn't volunteer to speak in Spanish for part of this, I'll ask him to, and he did on his own, to his credit. Listen, we had this conversation earlier, and folks, again, I want to repeat something I said and Judy underscored. The past 2 days, hospitalizations are up over 100 per day, 2 days in a row. And that's a concern. Now, it's well below, and Judy has calls. I speak to these folks all the time. Judy speaks to them far more so than I do. The hospitals, that's spread across 71 hospitals, right? So there's no, I don't want to put words in your mouth, there's no one place that this is exploding right now. It's a state reality. But when you look at the models that we talked about a couple of weeks ago, those numbers are going to go up. And that's the one thing that we cannot let happen, and that is our hospital systems to get overrun. Again, 8270 was the peak in the spring. And remember, that was with a ban on elective surgeries at the same time. So there was a capacity that was essentially created. We had field medical stations that were set up. And then over 2,000 ICU beds, 2,080, I think was the max, and we're at 700 and something today. So God willing, we don't touch those numbers, but all levers remain on the table and have to remain on the table. And it's important to reiterate that. And it's another reason, folks, you're sick of hearing this. I don't blame you. Throw something at your television if you're watching. I don't blame you. I would as well. But don't screw up Christmas. Don't go big. Don't go multi-generational. Stay within your immediate family. We saw the, Thanksgiving perhaps better than we feared. I think that's fair to say, but we still saw the fallout, and I think you're seeing some of these hospitalizations reflective of folks who were infected, 2-3 plus weeks ago. So Judy, for that and for all, thank you. Pat, we got Dave Daly of PSE&G as if on cue reached out to me just 5 minutes ago and said, Governor, I'm sure you are looking at this, but the weather's nasty. So compliance on the one hand, but folks, we do have some nasty weather, and as luck would have it, it is 2020, by the way. It is coming in Christmas Eve into Christmas Day, and it looks like it's 1 to 2 inches of rain, but it looks like very strong winds, and that means likely power outages. So with that wonderful upbeat entree, Pat Callahan, great to be with you.
Merry Christmas, Governor.
Exactly.
Good afternoon, everybody. Since we last met, just one EO violation, and that was in Dover. Dover police were called to respond to a landlord-tenant dispute where the landlord had removed the tenant's belongings, changed all the locks, and threatened to kill the tenant if he returned. So he was charged with terroristic threats as well as the EO violation for that improper eviction. And to your point about
kind of spirit of the holiday season there exhibited by him.
Yes. And with regard to the weather, while I was sitting here as well, Joe Fiordaliso, the president of Board of Public Utilities, reached out. The wind is going to be a great concern. The rain, it is probably a good bet that people are going to wake up Christmas morning with no power. So have generators ready to go, batteries for flashlights. Remember to run those generators outside so we don't have a carbon monoxide tragedy. Again, I'm always about avoiding downed power lines. And the other fear is it's going to be warm. So with all the snowpack, we might see some flooding throughout the state with quick melting. And then also the temperatures bottom out during Friday, so you're going to have some black ice and you're going to have some slick road conditions on top of it. So just kind of a wet, windy, turning to very cold with some flash freezing expected. So just again, preparedness is one of those pillars of emergency management, and just recommend that everybody, even though it's Christmas morning, to the governor's point, 2020 might just go out as it started. Thanks, Governor.
Thanks, Pat. So again, folks, warm on Thursday. Rain beginning, it looks like Christmas Eve. By the way, we'll aggressively communicate on this. Ready.nj.gov is always a good place to go. Ready.nj.gov. We'll communicate aggressively on this, but pretty warm on Thursday, tomorrow, Christmas Eve. Rain beginning into the night, high winds, and then temperatures bottoming out pretty dramatically Thursday to Friday, right?
And we might even have some snow in the north and central parts of the state because of that temperature drop, which just adds another, to our point about staying home and staying small. I think it's just another good reminder for us all to do that.
And the locusts will be arriving on the 26th. That's right. If I could, Sarah, we're going to start over here with Dustin just to review the schedule. So we'll be with you virtually for the next 3 days. And we will, unless you hear otherwise, I've lost Dan Bryant, we will be with you Monday and Wednesday next week, at this moment, at least at 1 o'clock We had a good, I should say a couple of other quick things before Dustin jumps in here. I thought we had a good White House call again on Monday. And they previewed what you're now seeing in the press today. So the feds had bought 100 million doses from Moderna. They had the second 100 million from Moderna locked up. So that'll be 200 doses. They had 100 million Pfizer on Monday. You've seen in the press today, they previewed the fact that they were close to getting the second 100, and that's now out there. That's a 200 million number. And then when you take out the folks who are 16 and under, et cetera, you're getting within shouting distance at that point of having what we need as a nation, which I thought was encouraging. General Perna, New Jersey's own, cleared up some questions that were out there. Debbie Birx and Tony Fauci were also there. I want to give her a shout out. She's been very good to us. She announced that she's going to retire soon, and I thank her for her support. Completely unrelated, we had a really remarkable event yesterday in Paulsboro, where the offshore wind, not just the fact that we'll have clean energy coming from the offshore wind industry, but that we're actually going to make big chunks of the supply chain in New Jersey. And we christened a port in Paulsboro, which if you don't know that community, it's a magical community, sits right on the Delaware. I can tell you, having been there yesterday, it's pretty chilly this time of year, but it was a remarkable, tangible step. I was with Senate President Sweeney, Chairman Assemblyman Berzicelli, who's the former mayor of Paulsboro.